The following message is transmitted through the Center of Disease Control in Atlanta, Georgia.
All doctors to be all nurses to the nursing station.
This is Ground Zero, Wuhan, a city of 11 million people. The coronavirus was first identified less than 3 weeks ago. At least 80 people have died and almost 3,000 infected worldwide after the virus spread across several continents.
This is a very large outbreak.
It's almost impossible in the modern world to prevent a viral infection such as this crossing borders, because most people who cross borders are asymptomatic.
This situation is evolving quickly, and I do expect more cases in the United States.
Please cover your nose and mouth when sneezing or coughing.
We're going to begin screening passengers arriving from Wuhan into the United States at the 3 airports that see the majority of those passengers.
CDC Emergency Operations Center. This line is being recorded.
We are the watch team here at the CDC. We're basically like the CDC's 911.
Everything that we're going to do, we're going to do a quick assessment and then we'll get you hooked up to our monitor, okay?
A lot of times these patients just need validation. They're scared, rightfully so, and so I think a little bit of reassurance goes a long way.
We're also going to put a blood pressure cuff on you, okay?
You guys are ready to move forward. 2 hard backs.
We have a core team of people that have been trained in addressing transports for highly infectious diseases.
In Wuhan, an extraordinary project is taking shape to build 2 hospitals with hundreds of beds within weeks.
Within a few days, the patient develops full-scale pneumonia. They struggle to get air into their lungs. With no cure for the disease and no drugs to help, the patient gasps for breath.
The city's empty, man. Like, the population's 11 million people. I can only see maybe 1 or 2 people on the street.
自己可能毕竟也都很年轻嘛，然后可能心里会有一些不知道恐惧啊，或者是担心啊，都会有，像家人都会有担心，但是感觉穿上那个衣服就没有担心。
Nobody here knows how long the outbreak will last, how far it will spread, and how many lives it will claim. A nervous wait for those trapped at the epicenter and beyond.
People sound afraid. There were a number of questions about whether or not they may have been exposed to the virus without them knowing.